And we're talking about the lymphatic or the lymphoid system. Those two terms get used interchangeably. Previously, the textbook publishers, had it written up with it described as a lymphatic system, but in this newer edition, they've kind of switched over to calling it the lymphoid system. I guess I'll probably catch myself referring it to the lymphatic system more often, but just know that those two terms can be used interchangeably. It includes some fluid and some structures, and I'll go ahead and let you fill in all the blanks, and then we'll talk about them. All right, so the lymphatic or lymphoid system consists of a fluid called lymph, vessels called lymphatic vessels that transport the lymph. Then you have a number of structures and organs containing lymphatic tissue, which is a type of tissue with lymphocytes inside. And the lymphocytes, remember, are the white blood cells that we previously learned about just a couple class periods ago. Those are one of the 5 types of white blood cells. Okay, we described those lymphocytes as being the major soldiers of the immune system. And so they're going to be found within our lymphatic tissues. And then also the red bone marrow that we've previously talked about, which is where we make those lymphocytes and other white blood cells, but also our platelets and our red blood cells. And we talked all about that, like I said, back in our blood lecture a couple of class periods ago. Our lymphatic system assists in circulating body fluids and helps defend the body against disease-causing agents. It is closely associated with the cardiovascular system because it picks up fluid derived from our blood, or what we would call interstitial fluid that is now between the cells outside the blood, and that forms what we call lymph. Lymph is a colorless, watery appearing fluid, and then you've also got a group of vessels that return it back to the blood. So we'll kind of look at this a little bit more in our next couple slides. But when stuff leaves the blood, and majority of that is water, it becomes interstitial fluid. And then typically that goes back into the blood, becoming blood plasma again, or a part of our blood, but not always is that interstitial fluid re-picked up, okay, or picked back up by the blood. Instead, it gets picked up by these lymphatic vessels, which are found throughout the body, kind of just like our cardiovascular blood vessels are. Okay. And then the lymph that is formed when that fluid gets picked back up gets drugged back to 2 places, essentially right here and right here. And then we return that lymph back to the bloodstream. Essentially what happens, if I kind of zoom in, these 2 points right here are where the lymphatic system meets the cardiovascular system, meets these veins. And we'll see, like I said, here in a couple slides. And so that lymph gets returned back to the bloodstream. Now, while that's taking place, there are lymph nodes found periodically throughout the body. You can see some of them are labeled here, which are the biological filters. Essentially, the lymph goes through and the fluid is filtered, okay? I'm kind of getting ahead of myself, but that's one of the 3 functions that I'll talk about, okay? As far as lymphatic tissue goes, it's a specialized form of reticular connective tissue containing large numbers of lymphocytes. So the 3 major functions or primary functions of the lymphatic system include the draining the excess interstitial fluid, which is what I was just kind of explaining, where the lymphatic vessels drain the excess interstitial fluid from our tissue spaces and return it to the bloodstream, okay? While that takes place, the carrying out of immune responses occurs. And so the recovered fluid and foreign cells picked up in other locations is passed through the lymph nodes where immune cells detect any harmful substances or harmful cells. Okay, what I haven't described yet, and we really won't get into it too much in this lecture, but we'll talk more about it in our next unit when we get to the digestive system, is that our lymphatic system also helps transport dietary lipids. Lipids are a fancy form of fat. So the fats that we ingest, as well as our lipid soluble, fat soluble vitamins A, D, E, and K, are absorbed by the GI tract and make their way into our lymphatic vessels where they then can be transported, which is different than what we do with basically everything else that we ingest and then absorb into the body through the walls of the intestines and the walls of the stomach. For example, when we absorb, carbohydrates, when we absorb proteins, water, electrolytes, those things go through the walls of our gastrointestinal tract and they go directly into the bloodstream. But for whatever reason, I don't really know the specific reason why. When it comes to fats and fat soluble vitamins, they get picked up by specialized lymphatic vessels, and therefore that's how the lymphatic system plays a role in transporting dietary lipids. And I've already mentioned this, but the lymphatic system supplements and extends the cardiovascular system, but the two systems are different in several ways. And those differences are listed here with these 5 following things. We find that lymphatic capillaries are more porous. Essentially, they have kind of bigger holes in them. Therefore, they are going to allow more stuff in. They are able to collect fluids, plasma proteins, and blood cells that have escaped the blood. Okay. Lymph moves in only one direction, whereas the cardiovascular system has a 2-directional flow away from the heart and then back to it. In the case of lymph, it's always flowing back towards the heart. It's never going away from the heart. It's always going towards it from wherever it's collected, whether it's in the arms or all the way down in the toes. It's going in that one direction back to its return to the blood. Now, unlike the cardiovascular system, there is no central pumping organ for the lymphatic system. There is no heart. So lymph must be propelled thanks to nearby skeletal muscles, the expansion and contraction of the lungs, as well as the contraction of smooth muscle fibers in its lymphatic walls or the lymphatic vessel walls. Okay? When that lymph is pushed into the bloodstream, it can be described as eliminated. And I really should put in there kind of like quotes, because elimination kind of makes it seem like it's being removed from the body, but that's not at all. It's just not lymph anymore, it becomes blood again. That's a different situation than what the cardiovascular system has. And then the movement of lymph is very slow relative to the flow of blood. For example, at rest, we're pumping about 5 liters per minute of blood, and that number can go way up into the 20s during exercise, whereas we're only pumping about 3 liters per day of lymph, and that's obviously significantly less than the amount of blood, even just in a minute. Okay. Now, the widely distributed organs and tissues of our lymphatic system can be classified into 2 groups based on their functions. We have what we call the primaries and the secondaries. The primary lymphatic organs are the sites where stem cells divide and become immunocompetent, which is something I talk a lot about in physiology. It's just a term that describes the ability to mount an immune response. So in other words, it's where those lymphocytes essentially mature and get ready to go and fight their immune battles. Okay, think of them like soldiers joining the military. I always tell students, think of the primary lymphatic organs like basic training, which is where a soldier goes once they've joined the military and they get trained in those specific things, whether they're in the military, the army, the navy, whatever. They get their specific training and then they're ready to go to battle. Okay, the training for these lymphocytes takes place in our primary lymphatic organs, and that includes the red bone marrow, which we've mentioned before, as well as the thymus, which we've also touched on just briefly back in our endocrine lecture. Then you've got the secondary lymphatic organs and tissues, which are the sites where most immune responses occur, which include things like your lymph nodes, your spleen, and various lymphatic nodules, which are things like your tonsils and the appendix. Now, this illustration is a pretty good illustration. It's actually one that you'll find in your textbook. It's fairly similar to this one that I've got a couple slides ahead. I don't have the capability, but if in a perfect world I did, I would take these 2 images and I'd kind of merge them to one, because there's some deficiencies in them. Some of the images, some of the parts of those 2 images are good, but they're not perfect. If I could put them together and make a perfect image, I just don't. So I'll have you highlight some stuff here, and then I'll end up having you highlight some of the same stuff in a couple slides when we look at that image on that page I just showed you. So here's what you need to know, at least for now. Highlight the following: the palatine tonsil, that's labeled; the submandibular node, that's labeled; the cervical node, that's labeled; the right lymphatic duct, the thymus, the thoracic duct, the cisterna-chyli, the intestinal node. I don't know why it's not bolded, because it is a very important structure as far as the lymphatic system is. So highlight the appendix and then highlight the red bone marrow. Over on the left side of the body, right side of the image, I want you to highlight the thoracic duct, the axillary node, the spleen. These structures called aggregated lymphatic vessels or follicles, excuse me, not fossils, follicles. I want you actually to rename those as Peyer's patches. And as you can see, we'll talk about those later in the lecture. All right, and then I want you to know the iliac node and inguinal node that are labeled. All right, what we're going to do is start by talking about the lymphatic vessels, which are labeled in this image, but if you notice, I skipped over them just because that's essentially all these little green squiggly lines. Not really a reason why I kind of skipped them, other than just there's so many, it's not that big a deal to identify them. So let's talk about lymphatic vessels, which are fairly similar to our blood vessels that we've recently talked about as far back as 2 days ago. But there's some obvious differences as well, and we'll kind of talk about that here as we roll through. All right, our lymphatic vessels are just what we can describe as lymphatic, system of vessels, very similar to blood vessels, except flow only occurs in one direction, which we already talked about, back towards the heart. Okay, so you don't have arteries, veins where they're going in opposite directions. Although they do follow a similar route as arteries or veins, they are absent in places like the central nervous system, so we don't have them in the brain or the spinal cord, don't have them in the bone marrow, the teeth, and any avascular tissue. Okay. We'll start with the smallest of our lymphatic vessels, lymphatic capillaries, which are very closely associated with blood capillaries. They are also microscopic, just like blood capillaries. Unlike blood capillaries, they are more porous and have a unique one-way structure permitting interstitial fluid to flow into them, but not out. Okay. They are going to be arranged or built with loosely overlapping endothelial cells, whereas blood capillaries have tightly joining endothelial cells. And if I kind of zoom in down here at this image, you can kind of appreciate what I'm talking about, okay? Essentially, the cells that form our lymphatic capillaries are those same types of cells that we saw the other day, endothelial cells, okay? Except, and you can kind of see it, the arrows are kind of annoying in that they're in the way, but the cells are not joined end to end, but instead they overlap one another just barely, okay? And what that enables is the cells to kind of separate from one another, which, as you can see, is going to allow stuff to come in. That's that interstitial fluid from the spaces between the cells is going to come in, but what we won't see is fluid going out like it is able to do with our blood capillaries. Okay. Now, attached to these lymphatic capillaries are anchoring filaments, which are what we actually can see here, these little green lines coming out from those cells. They contain elastic fibers and extend out from the lymphatic capillary, attaching lymphatic endothelial cells to surrounding tissues. When fluid pressure increases in the surrounding regions, the overlapping endothelial cells separate, which allows the fluid to enter the lymphatic capillary. The anchoring filaments will prevent the endothelial cells from collapsing, keeping the spaces open between the cells. Okay. Now, when fluid pressure inside the capillary exceeds pressure outside, the spaces between the endothelial cells closes, holding the fluids inside the capillary. So in other words, if pressure is higher out here than it is in here, the lymph is able to flow in because those cells separate, and the anchoring filaments help keep that opening open. Okay. Whereas if the pressure builds up higher here than it is out here, that little gap closes and thus prevents the lymph from flowing back out. Okay. Now, a specialized type of lymphatic capillary called a lacteal or lacteals, because there's many of them, occur in the finger-like projections, or what we call villi, which are in our small intestine. And these are what carry our dietary lipids. Okay, and then eventually that will drain back into the bloodstream, just like all the other lymph. Okay, but the presence of the lipids that are picked up from our small intestine causes the lymph from our small intestines to appear more creamy white, and therefore has a special name called chyle. Okay, not Kyle like the name Kyle, but Chyle. And we'll see lacteals when we talk more about the villi here, like I said, in our digestive lecture, which will be in our next unit. Okay. From our lymphatic capillaries, the lymph is going to flow into collecting vessels. Okay, so they receive lymph from multiple merging lymphatic capillaries. These vessels often travel alongside veins and arteries and empty into our lymph nodes. They contain valves, just like what we saw veins have, which prevents backflow, and they are actually very similarly structured to veins. Aside from that, because they've got those same three tunics or layers that we talked about in our last lecture. Okay. From there, the lymph is going to flow into the lymphatic trunks, and those occur with the convergence of multiple collecting vessels from a major portion of the body. There are 9 of these trunks, and their name indicates the locations of the parts of the body that they drain. Okay. Most of them are in pairs. The only one that's not, and that's why there's 9 and not an even number, is there's only one intestinal trunk. Okay. But there are 2 jugular trunks, left and right, draining lymph from the head and the neck. A pair of subclavians, left and right, that drain lymph from the upper limbs. A pair of the bronchomediastinal trunks, draining lymph from the thoracic walls, lungs, and heart. Once again, only 1 intestinal trunk, draining lymph from the stomach, intestines, pancreas, spleen, and part of the liver. And then 2 lumbars that drain lymph from the lower limbs, the walls and viscera of the pelvis, the kidneys, the adrenal glands, and the abdominal walls. And if you look here, we can see the last type of vessels we'll talk about, which are the collecting or lymphatic ducts. Okay, these are the largest of our lymphatic vessels, and they collect the lymph from those 9 trunks. They then are the ones that dump the lymph back into the veins, which are up there in the upper chest neck area. And there are valves located here at the junctions or junctures with the veins, preventing blood from entering the lymphatic ducts. Okay. There are only 2 of these, a right lymphatic duct and then a left or thoracic duct. And they are very, very different in size, and they carry very, very different amounts of lymph. Okay. The right lymphatic duct is only about 1.2 centimeters, not even an inch. It's about a half an inch in length. What you actually see right here, that from here to here, that's all it is. That's the right lymphatic duct. Okay, if I go back to the previous page, it was labeled in this image. Essentially what you were seeing on that picture at the bottom was this area of the body. That is all there is to the right lymphatic duct. Okay. It drains lymph from the right arm, the right shoulder, and then the right side of the head and neck. Okay. And that's why if we look down here at the bottom right, this lady is shaded yellow on these parts of her body, but the rest of her body is shaded green. Okay. The yellow area is the area drained by that right lymphatic duct. Okay, so it's only draining, I don't know, what is that, maybe like 15–20% of the body. Okay, and therefore is not the main duct for returning lymph to the blood. The main duct for the return of lymph to the blood, and I would highlight that just like I am right there, is the thoracic duct or left lymphatic duct. Much longer, not a half an inch, but actually 15 to 18 inches in length, 38 to 45 centimeters. It receives drainage from all parts of the body below the diaphragm, the left upper limb, the left side of the head, neck, and the thorax. So everything that's shaded green, which is like what, the other 80% of the body. Okay. It begins as a structure known as the cisterna chyli, which is an enlarged region, forms from the union of the intestinal trunk, the right and left lumbar trunks. Okay. And actually, if we go back to this previous page, that was one of the things that I had you highlight. This little bump or bulge right there is the beginning of that thoracic duct. From there, the lymph goes up, and you can see here's the lymphothoracic duct labeled. Okay, we kind of lose sight of it because it goes in behind the heart there. Then it comes up, and it does a U-turn. And as you can see, it's labeled again. Actually, there it is, right there, labeled. But then it comes up, and then it dumps in like so. If I go to that one picture, you can see it really nicely. And this one, here's the cisterna chyli. There's the thoracic duct. You can actually see it coming up and up and up and up and down right there. Whereas the right lymphatic duct is the much smaller of the two. Okay. Just like the right lymphatic duct, it joins essentially right where the left internal jugular and the left subclavian meet, that little junction right there. Whereas with the right, it was where the right internal jugular and the right subclavian met. And then there's a valve there. There's a valve there that prevents blood from going back up into those ducts. As far as the images on this page, I'm not really worried about you knowing them. Just wanted to kind of include them though to point some stuff out. Now, as I mentioned earlier, as that lymph is on its way back towards the heart, it's going to be filtered by our structures called lymph nodes, which are found throughout the body. So let's talk about those lymph nodes now. All right, once again, I describe lymph nodes as filters. They're oval shaped, placed along the path of lymphatic vessels, especially abundant where lymphatic vessels merge to form trunks, both superficially and deep throughout the body. Once again, they function as a type of filter. As lymph enters one end of a lymph node, foreign substances are trapped by reticular fibers within the sinuses of lymph node. Macrophages then destroy some foreign substances by phagocytosis, while lymphocytes destroy others by their immune responses. And I always tell students, kind of think of these reticular fibers like a spider web. Okay, if you think about what a spider web does, obviously it gives a spider a place to kind of hang out, but more importantly, it catches bugs and whatnot, and then the spiders can go get an easy meal. In the case of these reticular fibers, they help trap the foreign substances like a spider web. And then the spiders are kind of like the macrophages and the lymphocytes, which then can destroy whatever got trapped. Okay. Once that filtering process has taken place, the filtered lymph can then exit the other side of the lymph node. And we'll get into all that here as we roll through. So let's talk about the structure of a lymph node. We've got a partially sectioned lymph node here so we can see its kind of general makeup. Let's start by talking about its capsule, which is shaded green here and is on the outside. It is similar to what we've seen in other organs with a kind of connective tissue structure on the outside. Okay, but more importantly, the capsule extends into the node. It has these extensions called trabeculae, which help form compartments within the node. Okay, the trabeculae also provide support and a route for blood vessels into the interior of a node. Okay, and internal of the capsules where you find those reticular fibers and the cells called fibroblasts. We look here, all these little white kind of finger-like extensions that are going all over the place on the inside of the lymph node. Those are the trabeculae. Now you see here trabecula is without the E at the end. That's labeling just one of them. And that's because when you have just A at the end, it's singular. Whereas if you were to label multiple, it would be plural. The function of those is to create these, what we call sinuses, these irregular shaped places or irregular channels where you find branching reticular fibers, lymphocytes, and macrophages. Okay. I'll get into that a little bit more in a second. Let's first talk, though, about these vessels called afferent lymphatic vessels, which are the vessels that carry the lymph into the node, and they do so kind of on the rounded convex side. On the other side of the node, on the indented side, are efferent lymphatic vessels. Efferent lymphatic vessels are the ones that drain the lymph out of the node. As you can see, they both have valves, which is going to ensure that the flow is always in a forward direction, similar to what we saw in veins and similar to what we saw in the heart. Okay. We have a lot more of the afferent vessels bringing the lymph in than we have the efferent lymph vessels carrying the lymph out, which creates kind of a log jam or a traffic jam where the lymph has to kind of trickle out and can't rush through. Okay. So that helps to slow down the flow of lymph to give time for those lymphocytes, macrophages, and whatnot to do their immune responses, whether it's, phagocytosis like the macrophages do, or whatever it is, and then we don't get into it in this class, that B and T cells do, which are the lymphocytes. Okay? So that's one way to slow down the flow of lymph. The other way, and it's thanks to those trabeculae creating these channels called sinuses. Okay. These sinuses allow the lymph to flow through in a very kind of zigzag, non-straightforward manner. Essentially, the lymph can't just rush from one side of the node to the other. It has to kind of zigzag and go through like a puzzle on its way across. Okay? And there are different types of sinuses. The first sinuses, and these are the ones that initially receive the lymph, are called subcapsular. That's because they're below the capsule, okay, immediately beneath it. Sub means below or beneath. Okay. From there, the lymph flows through the trabecular sinuses, which extend to the cortex parallel to the trabecula, and then into the medullary sinuses, which extend into the medulla. Okay. And the cortex, the medulla, those are just different regions within the inside of the lymph node. There's actually two parts to the cortex, an outer cortex and an inner cortex. The medulla, as we know, that's a word that means towards the middle part of an organ. So the lymph is flowing just kind of on its leisurely route through the node, and that once again gives time for all those different cells to do their job. Okay. And when the lymph leaves, it comes out through the efferent lymphatic vessels, which are found on the indented part of this organ, or this lymph node. And the indented term for this is hilum. Okay. A hilum is a region in an organ where there's a essentially indentation. And this is not the last time that we'll see an organ with a hilum. For example, your kidneys have a hilum. In fact, these look like miniature kidneys. The lungs have a hilum. There's several organs here that we'll see here in our last few class periods, because we're really getting down to the end of the semester. But there are several organs yet to talk about that have a hilum. In this case, your lymph nodes too. Okay. Now we've got a couple different pictures here. Over on the right is a pretty cool microscopic view to show you on the outside of the capsule. Here you can see kind of the white little line here coming down into the node is one of those trabeculae. Then you can see very nicely the outer cortex, the inner cortex, and then the medulla. Down here is a really cool picture. You can actually see an inguinal lymph node. So this will be kind of in the groin area, where you can see the afferent vessels carrying the lymph in, the efferent vessels over there on the top carrying the lymph out. Not a real perfect image to show you kind of the shape to it, but hopefully you can appreciate it nonetheless. Never going to be a perfect, kidney bean shape like this is, but hopefully fairly close anyway. I do want you to highlight some stuff in this image. And so I'll just kind of go down on the left side and then over here on the right side. Go ahead and highlight the valve that's labeled. Definitely more so know the afferent vessels, and there's a couple of different spots where they're highlighted or labeled. Highlight the capsule that's labeled on there in the bottom. On the top right here, starting with trabecula, highlight that. Once again, that's the little white band coming in. Highlight the outer cortex, the inner cortex, and the medulla. Highlight the efferent lymphatic vessels, their valve that's labeled, and then the hilum. Hopefully nothing too crazy for you, but I want you to know those things for the exam. All right, let's talk about the groupings of lymphatic or lymph nodes, excuse me, which get special names. There are more than what's listed here, but I've included some of the most prominent groupings. By the way, that's ILIAC, not LL. Looks like there's two L's, but it's an I at the beginning. It spells iliac. All right, there are about 600 bean-shaped lymph nodes throughout our body located along our lymphatic vessels. We find them scattered both superficially and deep, usually occurring in groups. And if you've got a pretty significant or large group, they have a special name. And it's basically just describing where they're at. So hopefully right away you can tell exactly where your cervical lymph nodes are, which we all know our cervical region, hopefully by now anyway, is your neck. Okay, and so these are located alongside the sternocleidomastoid muscle that we learned about. And they drain lymph coming from more superior lymph nodes. And you can see those are very nicely shown here in our image at the bottom. Those are the ones a lot of times when you go to the doctor, they will kind of feel on your neck, try to find if those are enlarged, because that does happen when you get sick. They get a little bit inflamed, and it's called adenitis, an infection in your lymph nodes. The submandibulars are not actually visible here, but if I were to go back to that first page, you can see them labeled in the image there. They are found kind of on the floor of the mouth, and lymph from the nose, lips, teeth drain through them. And we call them submandibular because they are like basically deep to the mandible. Okay? The superficial cubital lymph nodes are located above the bend in the elbow, and lymph from the forearm passes through these. They also go by the term supratrochlear. I'm not too concerned with knowing that other name, just cubital or superficial cubital as they're more specifically named. Then you got in your armpits the axillary lymph nodes, which are cluster of deep nodes within the underarm and upper chest region, and they drain lymph from the upper arm and thoracic wall. And then kind of down there towards your hip are the iliac and inguinals. The inguinals are more kind of in the kind of groin area. They are shown here, whereas the iliacs would be much more up here, which if I go back to that first page again, you can kind of appreciate the difference with them there. The iliacs farther up, inguinals are farther down. So that's one way to kind of easily tell them apart. But they drain lymph from the pelvic organs, legs, and external genitals. There's also others that you could probably find names for, but these are the ones I've kind of chosen. Most reason probably just because they were the ones that were actually labeled in these images, which, speaking of, like I said, this image is not perfect, nor is the one on the first page, but you can pretty much bank on one of the two being on the exam, whether it's the first one, whether it's this one, I haven't really decided yet. But here's what you need to highlight for this fella. Starting on the left side, go to highlight. I'm gonna skip the tonsils because they're not specified which one there is, and we're gonna talk about the tonsils here in just a second. So don't worry about that, but do highlight the cervical lymph node that's labeled, the right lymphatic duct, superficial cubitals, the Peyer's patches that are labeled here, the red bone marrow, the thymus, the axillary nodes, thoracic duct, the spleen, the cisterna chyli, and the inguinal lymph node. You're also going to want to, I don't know why it's not labeled, this little pigtail coming off of the large intestine, draw a circle around it or whatever you need to do and label that your appendix. No idea why it's not labeled. Like I said, there's some good things to these images, but there's some definite deficiencies. So now let's talk quickly about the connection between breasts and the lymphatic system, which is more so related to females because of the significant structures associated with their breasts compared to men. But there's a very significant tie-in between the mammary glands and then the other breast structures in the lymphatic system. Okay. There are two sets of lymphatic vessels associated with the breast. The lymphatics that drain the skin over the breast, with the exception of the areola and the nipple, and then the lymphatics that drain the underlying substance of the breast, where the mammary glands are, and the fat and whatnot, as well as the skin of the areola and the nipple. And when you look at this illustration, you can see that there are kind of two routes. There's a third, but it's not as significant as over on the lateral side over there by the armpit, and then over here by the sternum. Okay, about 85% of the lymph from the breast enters the lymph nodes in the axillary region, and therefore, travels in this direction, whereas about 15% travels along the lateral edges of the sternum. And you can see those very nicely in the image at the bottom, but it's not an image I'm going to worry about you knowing. But this is, and the reason that there is such a connection between the lymphatic system and the breast tissue, and why I bring it up, relates to, and typically when I teach this in the fall, it's towards the end of October, kind of into November, right after, which October is Breast Cancer Awareness Month. And this, unfortunately, is a type of cancer, breast cancer, that originates in the breast tissue, but is very prone to metastasizing, spreading throughout the body. And the big reason why is just this connection that exists between the lymphatic system and the breast tissue. So, unfortunate situation there. All right, let's talk now about lymphatic nodules, not to be confused with lymph nodes. Let's talk about nodules, and I'll explain the differences. But first, go ahead and fill out your blanks. All right, lymphatic nodules, not nodes, are egg-shaped masses of lymphatic tissue that are not surrounded by a capsule. So that's a key difference than what we saw with lymph nodes, which do have a capsule, okay? Another big difference relates to their function in that these guys don't filter lymph. Lymph does not flow through them. They're not biological filters like our lymph nodes. but instead we find them in what's called the lamina propria, which is a type of connective tissue found in our mucous membranes, and those mucous membranes of the gastrointestinal, the urinary, the respiratory, and reproductive tracts. So you're going to find them in places like your throat, in the digestive tract, as well as within structures like the vagina and the urethra, which are as urinary and reproductive function. We'll talk more about those kind of things later in the semester. For the reason that they are associated with mucosa membranes or mucous membranes, another term for them are mucosa-associated lymphoid tissues, or MALT for short. Okay. What they have on the inside of them are lymphocytes and macrophages that can protect against bacteria and other pathogens that may enter these passages with food, air, or urine. So they are helpful in that they filter, but not in the kind of same way that we see our lymph nodes filtering. Okay, they don't filter lymph, but instead they do provide protection just in specific areas of our body. Most of the time we find them being small and solitary, but there are a couple of situations where there's kind of a large cluster or aggregations of them in specific parts of the body, and therefore have special names. You have those Pyrus patches that I had you label on the first page, and we've seen them on 2 different pictures now, which also go by the term aggregated lymphoid follicles. But these are found in the mucosa lining the ileum of our small intestine. And so another situation where we'll talk about these again in a few weeks. When we get to talking about the digestive system, we'll talk about the small intestine and its ileum, which is its actual last part. We'll see these again, and I'll point them out at that point. And then you've got your tonsils, which there are typically 5 of them occurring in the mucosa lining the pharynx, which is a fancy word for our throat. And then the appendix that I had you label on the slide the picture a couple slides ago is a cluster of nodules at the beginning of the large intestine. And, we'll talk about the appendix again. When we talk about the large intestine, we'll kind of see its structural makeup at that time. For now, I just wanted to point it out in those 2 pictures and make sure you identify them. Let's talk a little bit more about tonsils though. Okay, we have these, like I said, in a protective ring in the mouth. What we call the pharyngeal lymphoid ring is its special name. And their job is to protect against bacteria that may invade the tissues around the openings of our nasal and oral cavities. So in other words, either through our nose or in our mouth, which are obviously, subject to pretty easy invasion. Whenever we breathe, whenever we ingest anything, there's going to be bacteria and whatnot coming along with it. Okay. Once again, there are usually 5 tonsils. That includes 1 of the adenoid variety, or what we will call pharyngeal tonsil. It's embedded in the posterior wall of the nasopharynx. That's up more in the nose area, not in the actual nose. The nose is all of this structure, obviously, but it's in the part of our throat just posterior to our nose, what we call our nasopharynx. Okay, and if I go back to this picture, that's actually the tonsil that was labeled here. And the others are closer associated with the mouth. Those include 2 palatines and 2 linguals. Okay, so you've got 1 of these and then 2 of these, although we can only see 1 of each of these because this is showing you only like half the head, because it's a sagittal section. Okay. Palatine tonsils are at the posterior region of our oral cavity on either side, and you can see them very nicely here. Those are the ones that are typically kind of a bugaboo for people, and thus are removed if they get too big and affect swallowing and breathing when somebody has a tonsillectomy. Okay. Now, sometimes the linguals are removed, but typically when a tonsillectomy is performed, it's these that are removed. Okay. The lingual tonsils are associated with more of the tongue, and therefore that's why they are called lingual tonsils, because the word lingual means tongue. Okay. They are at the base of the tongue, and just like the palatines, there are a pair of those. Now, there is a procedure where the adenoid or pharyngeal tonsils removed. That's called an adenoidectomy. Okay. I do want you to be able to identify the tonsils that are labeled here and the ring that's labeled here, as well as the tonsils that are labeled here. Keep in mind, you wouldn't actually be able to see this pharyngeal tonsil here in the left image without the palate, the roof of the mouth being cut. So like you can't just open your mouth and see those because like all this stuff is in the way. So essentially over here, you can see it's cut basically from here back. That's all been removed to give you a view of the pharyngeal tonsil. This image we are going to see in our next lecture. Actually, what I've essentially done is I've got a blank version of it and drawn in the arrows to these three things because in the next lecture, when we talk about the respiratory system, you're going to see the image with a heck of a lot more stuff labeled, and that's probably what we'll get to next week after we finish our exam. So you'll have that to look forward to. All right, let's talk about the thymus again. Not the first time we've discussed the thymus. Is there just this one blank on the page? Okay, kind of random blank, but whatever. The thymus is a bilobed organ, which means it's got two lobes. It's located just above the heart in the mediastinum, which we've learned all about that before. Surrounded by a capsule separating the two lobes. But just like what we saw with lymph nodes, that capsule penetrates inward and separates the lobes into smaller segments, what we call lobules. And we've got a picture on the right side showing you one of those lobules. Over here on the bottom left, we see the capsule, and you can see some of the extensions inward that create the individual segments called lobules. Here would be one lobule, there'd be another, and we'll get into a little bit more about that in a second. And each extension of the capsule are called trabeculae or trabecula if you're singularizing it, just like what we saw with our lymph nodes. Each thymic lobule consists of a deeply staining outer cortex and a lighter staining central medulla. You have a cortex closer to the surface, which makes sense, and a medulla that's deeper. We know those words by now. I introduced them in the very first lecture of the semester. Within the cortex are a large number of T cells, scattered dendritic cells, epithelial cells, and macrophages. Okay. Whereas the medulla, you've also got T cells, but they're more mature T cells, and they've also got epithelial cells, dendritic cells, and macrophages. And essentially, the cortex is where those T cells gain their maturity. In other words, they basically, it's kind of like growing up. This is like a soldier coming to boot camp, and they are getting trained. And once they are trained, they move to the medulla, which then enables them to leave the thymus and enter the bloodstream to go to places like our lymph nodes and our tonsils and whatnot that we just talked about. Remember, the thymus is one of those two primary lymphatic organs where those cells become immunocompetent. Okay. Within the medulla are also thymic or Hassel's corpuscles, which are dense concentric layers of epithelial cells. We don't really know what they do, but they may serve as sites of T cell death in the medulla. Okay. We can describe the thymus as a whole as a very important site of immunity in children and as a reservoir of lymphocytes. We have talked about it before, and that's because it releases various hormones, which includes thymosin, that enable the lymphocytes to develop into mature T cells to be used for immunity. I've already talked about this bullet, but immature or pre-T cells, as they're labeled here, migrate through the blood from our red bone marrow or myeloid tissue, where they go to the cortex to continue development. And then once they mature, they enter the bloodstream on where they leave the medulla. Okay, they can either jump into the blood or the inferent lymphatic vessels and migrate to other lymphatic tissues and organs where they become immunocompetent or active in immune responses. It's important to understand your thymus is not going to play any direct role in immune responses. No filtering, no protection takes place here. It's just the getting ready for battle boot camp kind of analogy, if you want to think of it that way. That's taking place here. The development of, and it's all about like the plasma proteins that they, or the plasma membrane proteins that they develop that then enable them to go attack viruses and bacteria and whatnot. Okay. The blood thymus barrier is a barrier providing an antigen-free environment necessary for the development of our T cells. And I've mentioned this before, but it actually shrinks with age. In infants, it's 70 grams, but by the time we are of old age, it's only 3 grams, and therefore is replaced with adipose and areolar connective tissues. And so that's why a lot of times you see pictures and models and whatnot that doesn't include the thymus in it. And we've seen this image on the left before. This is that same one that we included in the endocrine lecture, where you can see its location right there between the lungs and sits on top of the heart. Not to be confused with the thyroid, which is strictly endocrine. It has nothing to do with what we're talking about today, but is sometimes confused with the thymus. The thyroid's up in the throat, beneath your windpipe, or beneath your voice box. As far as the images on this page, nothing too important to worry about. So we'll just jump ahead to the next page. All right, our largest and last lymphatic organ to discuss is the spleen. It is located directly below the diaphragm, which once again is that muscle that separates the thoracic and the abdominal pelvic cavities from one another. It's posterior lateral, so it's a little bit behind and a little bit to the side of our stomach and the left hypochondriac region of our abdominal pelvic cavity. Okay. Superior surface of the spleen is nice and smooth and convex to conform to the concave surface of the diaphragm. Here we can see just how nice and rounded it is, which is pretty nice and handy because it nestles in very nicely with the diaphragm. Okay. There are some special indentations on the spleen, and it's due to kind of some neighboring organs crowding in on it. Those impressions or indentations have special names. The gastric impression is a result of the stomach pushing in on it. Okay. You can see this is a visceral surface. This is like looking at it, if you were kind of drawing an arrow, it'd be like, you know, this direction. And here are those blood vessels shown right there. The gastric impressions shown right there. Anytime you see the word gastric, it means stomach. Okay. Anytime you see the word renal, that refers to kidneys. In this case, the renal impression is due to the left kidney, and that would be right here. And then there's also a colic impression. Colic refers to large intestine, and it's due to we call the left colic flexure, which is where the left part of the colon kind of takes an angle and goes down from there. So it sits right there. But that's right here in the image. So those aren't labeled here, but that's okay. This is actually the figure from the textbook that shows those 3 impressions. Like lymph nodes, the spleen has a hilum or indented region where you can see these different blood vessels. There's also nerves, whatnot, traveling in as well. Okay. Surrounding the spleen, what we've seen in several other organs here today is a fibrous capsule with inward extensions called trabeculae. And that helps to divide the organ into compartments and creates 2 kind of functioning distinctive tissues of the spleen, what we call white pulp and red pulp, which you can see labeled in both of our images at the bottom. The white pulp is lymphatic tissue consisting mostly of lymphocytes and macrophages. So it's actually very similar in structure and function to our lymph nodes. Unlike lymph nodes, which filter lymph, the white pulp is filtering blood. Okay. Blood is going to flow into the spleen through the splenic arteries that we actually saw here up at the top. And we actually can see the tail end of one there. Okay. From there, those branch to form what we call central arteries, which are at the center, hence the name of the white pulp. Okay. This is where we're going to find those B and T cells carrying out their immune functions, similar to what they are doing our lymph nodes. We also find macrophages, which are going to destroy pathogens by phagocytosis. Once again, White pulp, very similar in function to what our lymph nodes perform, which is filtering, except we're filtering blood and not lymph, like our lymph nodes filter. Then you've got red pulp, which is going to consist of blood-filled venous sinuses and cords. We call those splenic cords, and you can see those are labeled right here. Within splenic cords, you find red blood cells, macrophages, lymphocytes, plasma cells, and then the 3 granulocytes, eosinophils, basophils, neutrophils that we previously talked about. So essentially, all the different types of blood cells are found within our splenic cords. And within the red pulp, the spleen performs 3 functions related to our blood cells. It can remove any defective or dead blood cells and platelets using the macrophages, those cells that are kind of like Pac-Man. We store up to 1/3 of our body supply of platelets in our red pulp, and then during fetal life, we undergo hemopoiesis or hematopoiesis, which is the fancy term for producing our blood cells. But as we know, that's not where it takes place the rest of our life, because the last trimester and through the remainder of our life, it takes place in our red bone marrow and not the spleen. So as far as the images on this page, you don't really need to worry about them. Even the ones at the top, there's nothing like specific that I'm too worried about, in there. So just make sure you can identify the spleen. Same thing for like the thymus, in this image, and then back on the first page as well. So, and with that said, we were able to cruise through that without too much trouble. So we have completed our mission on Unit 6.